Basic life support is a first aid technique that all DCHS community staff need to be familiar with and competent to undertake. It consists of a standardised sequence of actions that can be applied in all settings. The sequence is divided into two parts, SSS and ABC.
Goodbye, Mrs. Clayton. Would you like to make an appointment for 2 months' time, please? Mrs. Markham, would you like to come through, please?
SSS stands for Safety, Stimulate and Shout. Safety is the first consideration. Visually assess whether it is safe for you as a person coming to assist to approach the casualty. Look around the area for liquids such as water, urine that you could slip on, trailing wires that could pose a tripping hazard or live electrical cables. Once you have assessed the surrounding area, then it is safe to approach the individual. Stimulate is a way of checking whether the patient is conscious. Do this by holding the individual by the shoulders and gently shaking them. At the same time, speak loudly into each ear, asking, "Are you all right? Open your eyes."
Are you all right? Can you hear me? Open your eyes. Can you hear me?
It is important to give the patient a clear command so that you can gauge any response.
Mrs. Markham, can you hear me? Open your eyes. Can you hear me? Can I have some help, please?
Shout for help. This can be another health professional or a layperson. If someone comes in response to your shout, ask them to wait whilst you undertake the next part of the sequence before you give them any instruction. Once SSS has been completed, you need to assess ABC. This stands for Airway, breathing, and circulation. To open the airway and make sure the tongue is not obstructing the airway, you will need to perform a head tilt, chin lift. This is a two-stage process which involves placing your hand on the individual's forehead, applying some pressure to extend the neck, and at the same time placing your index and middle fingers under the point of the chin and lifting the chin upwards. Once the airway is open, look inside the mouth for any obvious obstructions. If there is an obvious obstruction at the teeth that you can pull out without placing your fingers behind the teeth, then do so. If the obstruction is behind the teeth, then leave it in situ until appropriate equipment is available. If there is fluid, such as vomit or blood, in the mouth, either turn the individual's head to one side or turn the individual onto their side to allow gravity to drain the contents of the mouth. Once the airway is as clear as possible, maintain a hand on the forehead and move on to assessing breathing. This is done by lowering your head down to just above the individual's mouth and nose. Turn your face so that your cheek is just above their face and your face is looking towards the individual's chest. Look for any movement of the chest. Listen for any breath sounds and feel for any breath on your face. Simultaneously, place your free hand gently on the individual's chest and move it over the chest, feeling for any movement. This process must not take more than 10 seconds.
4,
Circulation is not formally assessed, therefore we work from absence of signs of life. You are already aware that this individual is not responding to you from your stimulate from earlier. You can also look at the colour of the individual. They may be pale, bluish, or a mixture of reddish purple. Abnormal skin colour in combination with absence of signs of life is sufficient to establish no circulation. Absence of breathing and signs of life indicates that the individual is in cardiac arrest.
Call me an ambulance via 999 or 112 and tell them we've got a patient in cardiac arrest. It's a priority 1.
Although you can call 999 to contact the emergency services, calling 112 is better if you are using a mobile phone, as it uses GPS to identify your location. So if you're in an area that you are unfamiliar with, your location can be readily identified.
Hello, ambulance service please. Yes, this is St Oswald's Hospital outpatient department.
It is important to ask the person that is phoning for help to return to you and tell you that they have made the call so that you are aware that they have done as you have asked. This is particularly important if you are asking a bystander for help.
Could I have a priority 1 ambulance please for a lady in cardiac arrest?
Once cardiac arrest has been established and someone else is phoning for help, you need to start cardiac compressions. Kneel beside the individual. Ensure that your knees are about shoulders width apart. Place the heel of your hand in the centre of the individual's chest. Place your other hand over that hand and lace your fingers together. Position your shoulders directly over your hands. Keep your arms straight and if possible lift your fingers off the chest. Now push hard and fast on the chest at a rate of 2 compressions per second, 120 per minute. Make sure you are compressing the chest by at least 5 centimetres, 2 inches each time. Let the chest rise completely before giving the next compression. Don't take your hands off the chest, just your weight. This is the universal sign for a defibrillator or AED. Defibrillators can now be found in many public access areas such as shopping malls, leisure centres and train stations, as well as health centres and hospitals. It is important to attach the defibrillator to the individual as soon as possible, as every minute that passes without the use of a defibrillator reduces that individual's chance of survival by 10%. Defibrillators are designed to stop the heart from quivering, which is abnormal, and give the heart the opportunity to restart itself in a normal rhythm.
And then just put pads on showing you following pictures.
The defibrillators used by DCHS are semi-automatic. That means that they will analyse a rhythm to determine if a shock is needed, but you will need to press the button to make sure the shock is actually given. The defibrillator will talk to you and give you clear directions. If you get stuck or forget what to do, listen to the voice prompts. Once the pads are applied, the defibrillator will analyse the rhythm.
Tear open package and remove pads.
Okay now.
Peel 1 pad from plastic liner. Do not touch patient.
No one must be touching the patient during this time, as it can interfere with the analysis. Once the rhythm has been analysed, the defibrillator will either advise a shock or say it is safe to touch the patient.
Do not touch patient.
Make sure you're clear.
Analyzing rhythm. Shock advised.
If it says shock advised, it is the responsibility of the person who brought the defibrillator to make sure that no one is touching the patient and that oxygen, if it is being used, is removed to at least 1 metre.
Okay, we're going to shock this individual. Make sure you stay clear.
They need to look around the area, stating loudly that they are shocking before depressing the flashing red button.
Do not touch patient. Shock advised.
I'm going to shock this patient.
The defibrillator will automatically reanalyse the rhythm every 2 minutes.
Everybody clear.
And each time it is the person who brought the defibrillator who will go back to it and be in charge of it.
Shocking now.
Shock delivered.
Back on the chest, please.
It is now safe to touch the patient.
Most DCHS clinic areas and GP surgeries will have bag, valve and masks, BVMs. The BVM is used to provide ventilatory support to individuals in cardiac arrest or when the breathing rate is too slow. It can be used either using atmospheric air or preferably using oxygen at a rate of 15 litres per minute. There are 2 main ways of achieving an effective seal with the face mask. It doesn't matter which one you use as long as you are comfortable. You can either use the fleshy part of your hand between your thumb and your wrist to press down either side of the nose and tuck the tips of your fingers around the jawline, or you can form your index finger and thumb into a C shape and bring them together to form an O shape around the valve part of the BVM. Again, your fingertips should rest around the jawline. When giving ventilations, the bag should be gently squeezed between the index finger and thumb and the chest observed for rise and fall. If you are too vigorous in squeezing the bag, not only do you overinflate the lungs, but you also inflate the stomach, potentially allowing the stomach contents to travel up to the esophagus and drip into the lungs. Continue with resuscitation without interruption until either the individual starts to show signs of life, such as eye movement, coughing, purposeful movement of limbs, or spontaneous breathing, or until the paramedics take over. The ambulance ought to be with you within 8 minutes, although in some of the more rural areas of Derbyshire it may be considerably longer.
26, 27, 28, 29, 30. Oh, Sue, there's a lot more resistance through bag. I think she might be showing some signs of life.
Actually, there's a bit of eyelid flickering going on there.
As the individual is now showing signs of life, you need to ensure that their airway is protected. The safest way to do this is to place them in the recovery position. To place someone in the recovery position, kneel beside them on the side that you intend to turn them towards. Make sure the individual's legs are straight. Place the arm nearest to you out at right angles to their body, with a right angle bend at the elbow with the hand palm up. Bring the far arm across the chest and hold the back of the hand against the patient's cheek nearest to you. With your other hand, grasp the far leg just above the knee and pull it up so that the foot is flat on the ground. Keeping their hand pressed against their cheek, apply pressure to the far knee to roll the patient towards you and onto their side. Position the uppermost leg so that the knee is at right angles. Position the head so that the neck is extended and supported. Continue to monitor the individual for ongoing breathing, spontaneous movement and a pulse. Be prepared to recommend CPR if breathing ceases again. A clear handover is a vital part of any ongoing care.
Hi, thanks for coming. I'm John. This is Mrs. Markham, a 54-year-old lady.
SBAR is a good way to structure your handover. It stands for situation, essentially who you are and where you are.
For a podiatry appointment today. As I shouted into the clinic room, she collapsed on standing up.
Background, brief clinical detail about your patient. Assessment, what had happened that has caused you concern. Recommendation, what you would like to happen to your patient. Overall survival rates from cardiac arrest are low. However, the outcome can be improved through the use of early call for help and effective compressions.
I'd like you to take her to an acute hospital to be looked at.